You're tuned into Inside Lowell. Inside Lowell podcast brought to you in part by Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank.
Wellpoint. Unicare is now Wellpoint. New name, same commitment to Massachusetts. At Wellpoint, your whole health is their whole point.
Boston North Company, offering a wide variety of business solutions to help restaurant and retail clients save money. Boston North. Mahoney Oil Company, providing warmth and protection to families in Greater Lowell and Southern New Hampshire since 1925. That's Mahoney Oil. Francis E. Preventia Insurance. For auto, home, business, and life, trust the agency Greater Lowell has counted on for more than 40 years. Francis E. Preventia Insurance. GoPuff, a grocery store right at your fingertips. Use the code Lowell20 to receive $20 off your first order of $21, plus free delivery. Download the GoPuff app or visit gopuff.com today. And by the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Tsongas Center in Lowell. Get your tickets today by visiting masspiratesfootball.com. And now, time for another Inside Lowell podcast. Inside Lowell. If Lowell is your home, this is your place.
Hello again, everybody, and welcome to another Inside Lowell podcast, a health minute brought to you by Wellpoint, which coincidentally, we're bringing you this podcast from the beautiful Wellpoint studios here in downtown Lowell. Unicare is now Wellpoint. New name, same commitment to Massachusetts. At Wellpoint, your whole health is their whole point. And we welcome you to April's Health Minute, sponsored by Wellpoint, by bringing you Wellpoint's medical director, Dr. Carolyn Langer, back in the studios with us. Good morning, doctor. Good to have you here.
Good morning, Teddy. Great to be back.
We finally got through winter, ironically. We haven't seen each other since the winter month, but here we sit in April and we've got snow.
That's
outside,
right.
So everything's topsy-turvy out there.
Can't say it quite feels like spring yet.
Yes, we don't want April to become snow month, but what we do know is that April is Autism Awareness Month, and we want to talk a little bit about that because it strikes me that we've become an awful lot more aware of autism than we were in my day when I was growing up.
Yes, and I'm really thankful for that because I myself have a young adult son with autism.
Yeah, so you mentioned that off the air, and I'm glad that you wanted to talk about it because you can speak to the experience of how does that diagnosis change your situation as a parent, and also what does it mean for the child?
Yeah, so, autism spectrum disorder is really a broad set of symptoms. With this condition, children often have difficulty communicating, interacting with others. They behave, they learn in ways different from other children.
It's interesting you say broad spectrum because there are a lot of different ways that it affects people. And I do want to talk about that. But first, I want to start. How did you start to see the warning signs? And what are some of the things that parents can look for to try to discover if their child is dealing with on the spectrum?
Yeah, that's an important question because you really want a diagnosis as early as possible. The sooner you get these children into early intervention, the better the outcomes. But in our case, we just noticed that our son was not meeting the regular developmental milestones. And for most children with autism spectrum disorder, typically symptoms will appear within the first 2 years of life. It really is a broad spectrum, as I said before. In fact, Teddy, there's an expression that if you've seen one person with autism, well, you've seen one person with autism. And that's because the symptoms are so different from child to child. So it's, again, important to be attuned to the symptoms of autism.
You mentioned that most of the times it's diagnosed within the first two years of life, but there are examples where it comes later, right? Are the symptoms, do they come suddenly, or are there gradual things? Are there markers that you can kind of look for and that doctors look for?
Yeah, so in childhood, in early childhood, some of the first signs may simply be that the child is not meeting major developmental milestones. But I like to think of the symptoms as falling into three broad categories. So one relates to communication. And so what we'll often see in children with autism spectrum disorder is that they may have delays in speech. They may have unusual speech patterns. For example, they may echo others' speech. They may perseverate. They may miss certain developmental milestones related to communication. For example, they may not necessarily respond to their name by 9 months. They may not show certain facial expressions like sad, happy, angry by 9 months. They may not engage or use simple gestures like waving goodbye by 12 months. Perhaps they may show signs of not being able to follow a conversation. Another category where we often see differences is around social interaction. So many of these children just don't have any interest in connecting with other people. They may show poor eye contact. They may not necessarily show reciprocal play with other children. They may have limited interest in other people. They may fail to appreciate the emotions of others or themselves. And another category where we often see symptoms is around repetitive behavior, certain types of restrictive behavior. They may be very set in their routines. They may show certain types of self-stimulating behavior. So perhaps hand flapping, rolling their fingers back and forth. Each child is different.
So, it's fascinating. Everything you just described is things to watch for. My own children, I imagine everybody who's watching this, children may have seen it at one point or another in their own kids. It comes and goes sometimes. And when should if I see one of these things that you just described pop up, should I immediately take my child to get tested, or is there a standard time where children should be getting tested anyway for this?
No, great question. So the American Academy of Pediatrics recommends that every child be screened at their 18-month and 24-month exam. And of course, if parents have concerns in between or outside of those exams, they should certainly raise those concerns to their pediatrician or primary care provider.
So you start with the child's pediatrician and go from there?
Yes. So I would recommend that you start with the pediatrician, and if you are concerned, then you want to advocate for an evaluation. For example, you can suggest that your pediatrician refer your child into early intervention, and you can seek a referral through the early intervention program. These services are available to any child under 3 years of age, and the early intervention program will conduct an evaluation. And if the child is showing signs of having delays in certain areas, if they meet the criteria for early intervention services, the early intervention program will put them on what's called an individualized family support program, which lays out a set of services that the child could receive. So, for example, physical therapy, speech therapy, occupational therapy, and then a type of therapy called ABA therapy, which specifically is helpful to children with autism in many cases.
So with any medical health condition, obviously the earliest you can diagnose it, the better. The earliest you can start intervening, the better. Is autism kind of the same? Are you able to kind of offset or head off some of the things that come with it, or does it all really kind of depend on where on the spectrum the child is, and that's going to take its course, unfortunately, no matter how much you get on top of it early on.
Well, so each child is different, but as I mentioned before, the earlier you can get a child into some sort of early intervention program or into treatment, the better their outcome. Now, when a child is approaching 2.5 years of age, the early intervention program will typically refer them to the local school district, because at the third birthday, the child ages out of early intervention. And then at that point, the local school system is responsible for taking over their services. So it's really important that that referral is made in a timely fashion so that there's no disruption in services.
Okay, and so even a diagnosis doesn't mean that the child is now going to have to go to a different school or a special school. Most public schools are now equipped to deal with some of these and create an education plan that will help the children?
Exactly. Now, when a child is referred to the local school system, the school system will typically conduct an evaluation. They may conduct a psychological battery test. They may test the child for cognitive abilities. They may have the speech therapist, the physical therapist, the OT assess the child. And then the team will get together, the family with the special education services, and they'll determine together if the child is eligible for special education services. They'll determine what kind of placement that child needs, what kind of classroom setting, whether they can be serviced within the school system or require an out-of-district placement. But as you said before, more and more schools are able to accommodate these children within the school system, and then they'll develop what's called an individualized education plan, or an IEP, which lays out the set of services and the setting where the child will learn.
It sounds like an awful lot of variables in here. It must be difficult for a parent to deal with. What's the best way for a parent to begin this process? How do they start? I would imagine getting the most information you can right off the top is step number one, right?
Yes, absolutely. It's good to get information. There are a number of autism support centers throughout the state. Those are a wonderful resource. Parents can also go to mass.gov to locate an early intervention program near them. And then, of course, you can always call your health plan. Your health plan can help direct you to other resources, so to clinics and providers where the child can receive additional evaluations and services.
What about for the parents and the family? I mean, siblings, it changes things for them as well. What type of support, what type of services are available to them?
Yeah, great question. So many of these autism support centers and other nonprofits do offer sibling support programs for the parents, as well as educational and informational resources and webinars so that the parents can learn. But what I always say is the best way to learn is from other parents. And that's why it's so important to connect with other parents who have a child with autism so that you can learn from their experience. The
fact that you're here talking about it today and what I've learned in the past about Wellpoint, it sounds like anyone who's insured under the GIC through Wellpoint is going to have access to everything that you've discussed here, because you guys really do kind of go above and beyond for your members and the entire family, right? We do, and we do cover all these services: PTOT speech, ABA therapy. We have a special autism program. But for those who don't have Wellpoint for their insurance, I do encourage parents to call their health plan and see what services might be covered. All right. April is Autism Awareness Month. Dr. Carolyn Langer, Medical Director at Wellpoint, formerly Unicare. Thanks for joining us here. Always a pleasure. Thank you so much, and thank you for giving time and attention to this really important topic. We appreciate it, and thank you for sharing your personal story as well. This has been another Health Minute brought to you by Wellpoint. Thank you for joining us here at Inside Lowell. Till next time, stay safe, everybody.